Mrs. H is a 73-year-old woman who recently experienced an episode where her legs suddenly gave way. She didn't fall, but the incident frightened her, especially because she had a fall 4 months ago after tripping on a rug. Since that fall, she has been moving less and avoiding going out alone due to a growing fear of falling. A year ago, she was independent and driving, but her confidence has gradually declined. She reports feeling generally weak over recently. Medical history includes cataract surgery, recent urinary infections, tinnitus, hypotension, long-term steroid use, and pulmonary fibrosis. She struggles with multi-step instructions and worries about her steadiness. Her current medications include oral steroids, antibiotics for UTI, and blood pressure medication. Mrs. H says her goal is simple. She wants to feel steady again and regain some of the independence she's lost.
Now let's make a comprehensive problem list. Identify red flags, yellow flags. Are there any outcome measure you would like to use? Are there any interdisciplinary referrals you would consider? Based on Mrs. H's current condition and past medical history, let's make some realistic, smart, patient-centric goals.